Now, the American Urology Association recommends that clinicians use the minimal dosing necessary to drive testosterone levels to the normal physiologic range of 450 to 600. We keep using this word physiologic, meaning that the range that we would naturally produce. Now, the problem is, Stephen, that I don't see many men improving to any significant degree when we aim for the mid-normal range. Now, we've talked about this before, but I can literally show you dozens of studies where men were given testosterone and it did not work. It did not have a significant impact on their symptoms. And the common denominator in all of these studies is that they only raised testosterone levels a little bit. It's very important to point out that there is no medical data that supports treating to a specific number, such as the mid-normal physiologic range. It's an opinion. It was not based and is not based on any medical data showing that if we treat to a level of 450 to 600, that it works better than treating to a higher number. None at all. And more importantly, there is absolutely no evidence to support that testosterone levels on therapy should remain within the ranges for endogenous production. Once again, that recommendation is purely based on an opinion, not on medical data showing that that works best or doesn't work best, okay?
Right.
We've been doing this for decades because that's just the way we were told to do it, and we've really never questioned why. So, so what I have found, as have you, and has many others, our good colleague, Dr. Neil Rouzier, and many others, is that the most consistent benefits with testosterone have actually been with levels that exceeded the normal range, and that the higher levels of testosterone have correlated with a greater clinical effect. We know that, Stephen. We have studies. We see it in the Bayesian dose response studies where men were given 25, 50, 125, 300, 600 milligrams for 20 weeks. And those levels were outside of the normal range and resulted in greater improvement in mood, cognition, libido, and sexual function, as well as a greater increase in lean muscle mass and decrease in fat mass. So we still have to ask ourselves, should we give men what we call a physiologic dose of testosterone, meaning a dose to keep them in that normal physiologic range? Or should we be using a pharmacologic dose like we use insulin for a physiologic effect? Should we be adjusting dosage to treat symptoms, or should we be aiming at a specific number, even though there's no medical data to support aiming for that specific number in the mid-physiologic range?